first room that you guys come in is actually entrance right over here. This is kind of our reception lobby where clients are checked into the hospital. We usually have them call us as they get to the hospital, and that way we can let them in, which is why that's up there. But this space is kind of important because if clients are uncomfortable with all of the medical procedures, or it's too loud and there's too many animals, they have a space to wait that's away from that. So we do have some private spaces for owners that they can work in those areas. Patients have their vitals measured, they get their weights taken, and then we actually include a couple diagnostics in our exam. Our clients go ahead and get a PCV-TP, a lactate, a blood glucose, and a fusion check with our ultrasound here, and that's all part of our exam. And that's because we really strongly believe in using quantifiable evidence to be able to make our decisions. You know, sure, as a veterinarian, we get tons and tons of experience seeing these patients, but having the evidence to say, look, your patient's dehydrated, I know that because the packed cell volume is elevated in the patient, or the lactate's very elevated, there's obviously a lack of perfusion going on, is really powerful. We have our workstations right here. So we have all of this space for our technicians, our doctors, this space over here for our technicians and doctors. We work on the floor around our patients, around our clients in full view. So there's no, what are they doing in the back kind of thing. And obviously this is a hospital floor. You can see we have multiple gurneys here, which are fun units. They go up and down, so it can make really getting them out of the car much easier for our patients, or if they're not stable, we can work on them at the level that they're at. And we have these benches for our clients to sit on, and you can see that our low acuity cases all sit here on the hospital floor. These are your happy-go-lucky vomit, diarrhea dogs who need just a little bit more care, or maybe recheck radiographs, or maybe the owners don't want to wait 4 hours for care. They can leave their pet here and go get a coffee or go eat at our neighbors over here, and we'll call them when they're ready to be talked to, or we can Skype them. Over here we have our comfort room here. This is a private space for our owners, so if we do have a patient who's, say, a cat and it does not like other dogs or other animals, we can come into this space to be away from people. We can also have difficult conversations and procedures with people too in this space. So there is privacy for our clients and our patients in the hospital. From here, I usually go through the rooms as well as the lab stations that we have. So I'll kind of do that real quick. We have a nice surgical light that's mobile right there, so we can immediately get powerful light on the floor. And inside here is our GI isolation. So what's nice about this space is that a lot of hospitals will build their GI ISOs in the back of the hospital or in the basement or in a closet that they have. But I really wanted my patients who are typically in GI ISO, young puppies having parvo infections, to have that direct sunlight, so there's a little bit more of that warmth that those patients will have. Over here you can see some of our emergency equipment. This is a DigiCare monitoring system which has full capabilities from capnography, from EKG, blood pressure, temperature, can record that information for us. And this is our crash cart here, so we can immediately start working on a patient if they are an emergency situation. Inside here's our ICU. So you'll see that the ICU is very different than the hospital floor, and that's because this is where our high acuity patients are. We can go into the space. So this is where I wanted it to look and feel different so owners can understand that these patients require intensive care. We also assign more technicians to the pets inside this space, so they get more one-on-one attention as far as the patient to technician ratio. We also have 2 oxygen doors here, so we can supply constant oxygen to a patient who's having congestive heart failure, airway obstruction, tracheal collapse. Or we can also manage those patients that are septic, recovering from surgery, who need more intense care. Over here we have our wet table, which was custom made for us, including dropping the tub into it for us. And then we have one of our anesthesia machines in case we need to do a procedure. Over here we have, actually we'll look in this space real quick. This is actually respiratory isolation. I really wanted our isolations to be separate from each other because the last thing you want a parvo dog to have is kennel cough. or some kind of infectious disease that's airway borne. So we made this space for our clients to be able to wait when they do have a coughing patient, so they don't contaminate the rest of the hospital, and also so those patients can be in here, be able to get care, also have more oxygen available to them. More oxygen drop downs inside here as well. And we may do some dirty procedures here. We might use the ICU to do some dirty procedures like lacerations, attacked by dogs, abscesses, gross stuff. So basically a procedure that's not sterile. One that we're not going into abdomen, we're not getting surgically prepped and, maintaining that aseptic level of care. And that's because the infection or the injury is truly infectious right there too, or contaminated. So us getting less contaminated doesn't make much of a difference. This is our IDEX lab station. This is a really cool spot because it includes all of our diagnostics. We keep it out here on the hospital floor so people can see the diagnostics. We have tools like our digital cytology machine here. I'll go more into detail now. But this has your traditional equipment like your CBC, your chemistry, your complete good blood count, your chemistry panels that look at your organ function, which most hospitals have, including your analysis machine. But we also have some tools that most hospitals do not have. We also have a PTT for coagulation. We also have a VetStat, which is an EPOC machine. This is, or not EPOC, excuse me, HESCO would be very mad at me for saying that, but a blood gas. It's a quick, very fast point of care diagnostic that allows us to get answers in a matter of minutes. It's also much more affordable, so for a patient who just needs a little reassurance, we can run a blood gas on that patient, get a lot of information back, and be able to continue on our merry way. We also have a digital cytology machine here, and this is pretty cool because we can make a slide. It will be automatically scanned and read by this machine here, and then the image is uploaded, so we can go over that image with our owners. And you can see an example of a little blood that's on a slide right here. So you can zoom in, you can really show over part of the sample that you want clients to be able to see and know. So that way when they say, hey, I'm doing a cytology, owners actually get to see what are the results that we're looking at and how to compare it to what other patients might have. One thing that's nice about our hospital is we have the ability to show people what does normal look like in a patient, what are we looking for, and kind of teaching our staff how to do these things as well. And inside this room here is our quiet room. This room has extra studs throughout the wall to prevent reverberation. The drywall goes all the way up to the ceiling. The walls have these acoustic panels on it, including the back of the door, so we can reduce the sound transferring into the hospital floor. This is our laundry and food prep inside here. This is where we prepare our meals for our patients, do our laundry. We're actually able to reuse a lot of the cabinetry that was in the building originally in that space, which was awesome. So I was happy to be able to do that. We want to be able to offer more care and provide a second option. And the biggest limitation that we have is doctors. So the more doctors we can get, the sooner we can get them. Hopefully the sooner I can get the doors open for the practice. This is our radiology. This is where we have our x-ray table here. What's really nice about this room is that our radiograph's really nothing special. We see it in almost every hospital that we go in. There are some that don't. But what we have is that this entire room is lead lined.
Oh, that's so cool.
Including this wall and this glass. So when patients need to get a radiograph, you as the client can actually be inside this room over in our window. So you can actually see our patients while they're getting a radiograph and be there through the entire process. There's no mystery in this practice. This is our autoclave space. So this is where we keep our sterile packs, our items for surgery. This is where we have a pass-through window to decrease the amount of foot traffic that goes into surgery and hopefully preserve the sterility of that room. I'll show you more of that in a second. This door here kind of indicates the more private sections of the hospital, but we don't have a true rule that clients can't come towards these spaces. This is simply an area where our clients have no purpose to be there. I'll show you what I mean. Over here we have our call room. This is for our overnight doctors, so they have a place to stay when the caseload is low or our managed patients are very low. So that way they have the ability to get some rest. There's also a sink there where we'll do our surgical scrub, and that way the surgeons will prepare in this space before going into surgery over here. Our patients will be prepared on the hospital floor where they'll be brought into surgery for their final surgical prep, and then our surgeons will actually be prepared in the call room and come from a different entrance, which really helps with the foot traffic of the hospital. There's no let me go in and out, in and out, in and out, bringing different contaminants into the room. We also have that pass-through window, so if we needed something extra, we don't need to invite more people into the surgery to be able to contaminate it further. This is just our employee break room, so you can see what I mean. This is just, right now, more of a storage than a break room, but hopefully I can fix that this week. So, over here, we do have our storage as well as one of our freezers here. Unfortunately, we will see a lot of patients that are going to be going through difficult situations. That's why we have our morgue set up in here as well. This is our pharmacy over here. We have our locking door, camera system. Drugs that are going to be going home for our patients are stored inside here. I had special cabinetry made in here so we can better store some of this equipment. And you can see that we're back out here on the hospital floor.